There could be something seriously wrong with this patient. This is an important question, so thank you for asking it. Question is, I'm in my early 40s and I've been experiencing spotting between the 7th and 10th day of my menstrual cycle. I often feel nauseous and I suffer from abdominal pain. I even had to visit the emergency room for heavy bleeding. What do you recommend? First of all, my physician brain is going to, what do we want to make sure is not going on? So if you have a period or a weird period or a period that just doesn't make sense, you want to make sure you're not pregnant because even though you've had a period, you could still have a pregnancy that's not in the right place or not functioning normally. You could have an ectopic pregnancy, you could be having a miscarriage. I mean, these things are possible. And so definitely see your doctor. Now, with respect to spotting in the 7th to 10th day, that to me means it's a prolonged period. So usually bleeding is day 1 to 5 or 6 or 7, and then spotting from 7 to 10 for this patient. It means it's a prolonged bleed. Maybe it's part of the same period, or maybe it's something different. But what could be going on? The nausea, the severe back pain, the intermittent heavy flow that even required a visit to the emergency room. I'm concerned about the lining of the uterus. Is there precancer or cancer in the lining of the uterus that could be a concern, creating this prolonged, maybe irregular, and a sometimes even heavy blood flow? That requires an ultrasound to measure the lining thickness, the endometrial stripe, and it requires an endometrial biopsy or even a D&C that does a more extensive scraping inside the uterus to make sure that that lining is assessed and sent to the lab and evaluated for precancer or cancer. Now, beyond that, this could be simply, not simply, but simply dysmenorrhea or severe um, period pain, and we've answered that already. So I really hope that this person takes that seriously, goes to see their doctor for an ultrasound, endometrial biopsy, possibly some blood tests to make sure that things are normal, and a really, really good evaluation. Make sure you continue to track your cycles and mark the days that are spotting, the days that are heavy or light, and if this is period pain, then there are treatment options available to help, but you want to make sure that nothing serious is going on first. So thank you for asking this question. Don't forget to like, follow, subscribe, and send me your questions.